Well, while we're waiting for the others to come back, I'm going to have you go through this again. So, first of all, today's Valentine's Day. Not everyone celebrates it, but I think it's a good remembrance to try to do things from the heart. And so that's why I brought some flowers and these little heart balloons here to make it feel a little more heartish today. And all of you, I know, in the different things that your professions in your home life, you all do things because you really care about people. And so just remembering that is good to acknowledge each and every one of you for the heartfelt ways that you do things and throughout the course of the day. It might not be easy sometimes dealing with some of the people that you deal with or the situations, but you are coming from the heart, and that's really important for everyone to remember. So that's why you got this little Valentine's Day card on the front. It doesn't say from or to in it. So if you need to, you can always, they were very inexpensive at Walgreens, and I have a 12-year-old daughter I needed to get one for, so I have a whole selection of them now. Yeah, if you want to trade in your card for a different one, or if you want any other card for someone else, that's fine. I've got a lot of these. I was going to have Mark introduce me, but he went to prepare lunch things.
Oh.
So I brought a friend and colleague of mine with me today, Jamel Freeman, and he's going to do a little brief segment within my segment about the Affordable Health Care Act, because we are talking about health and human services and that today. So I thought that would be interesting too. But he's going to actually do my introduction, and then I'll jump into this.
Hello everybody. So I have a great introduction to give you today, but I want to just personal note, Jay's been my doctor since I was a little kid. Him and my dad are real good friends, so I know his services are splendid. When I was having knee issues, I did everything. I rubbed oils on them, I tried to stretch them out, I was trying to get taller, so I stretched like this and try to make them feel better. Nothing really helped, but he does acupuncture work, and that really did help to get me back to a good state where I could play again and feel comfortable playing again. So
He's a football player.
once upon a time. Alrighty, so it's my honor to introduce Dr. Jay Sordian to you today. Over the past 30 plus years, Dr. Jay, as he is affectionately called by his patients, has helped thousands regain their health and vitality and return to more happy, fulfilling, and organized lives. Patients find that 40,000 hours of clinical experience in a wide range of natural medicine approaches and modalities often provide insight and results that improve their work and home relationships and health. And after they have been to numerous other doctors without the results they were seeking. So Dr. J is a licensed acupuncturist, Oriental medical doctor, certified traditional naturopath, and qualified medical evaluator in the workers' compensation system. He also serves the community by educating the public about natural medicine, approaches for various conditions, speaking in companies, schools, libraries, senior centers, social groups. I know he came to speak in the Berkeley Chamber of Commerce. He came to speak with us there. Lions Club, Rotary as well. Dr. Jay Sordian, as a certified company wellness program consultant, has also provided education to the business community on effective company wellness programs through the Berkeley and Emeryville Chambers of Commerce, sponsors of Leadership East Bay. He also runs wellness programs for companies and departments that improve productivity and reduce healthcare costs through injury prevention, evaluations, confidential health screenings, health fairs, and lunch and learn programs for employees and public servants. So, and best of all, Dr. J is also a graduate of the 2010-2011 Leadership East Bay Group and serves on the steering committee. So, without further ado, Dr. J.
Thank you, Jamal. So how many of you have been to an MD in the last year? Raise your hands. Everyone? Not everyone. Almost everyone. Almost everyone. And how many of you have been to a non-MD practitioner in the last year? Raise your hands. Nobody.
Yeah,
All right.
what would you qualify as a
Non-MD?
Yeah,
Well, we're going to go into that.
okay.
So-
So like a dentist?
What?
Like
A
a-
dentist could, yeah, I wasn't thinking of dentist, but yes, a dentist
Okay.
could be, how about, anyone been to
Oh,
a
that's
dentist?
good.
Very good, we appreciate that, all those beautiful smiling faces here today. So, because Leadership East Bay, and I'm a graduate from 2011, so I've seen numerous different programs, and there's an emphasis on the Health and Human Services Day on a lot of the community services that exist, the organizations like BOSS and Berkeley Food and Housing Coalition, things like that. And there never seemed to be much of anything on alternative medicine, but because Berkeley, Emeryville, this area, has a lot of alternative medicine that's practiced here, and it has been sort of a central area in the whole country to like get that started. I thought a little segment on that would be appropriate. There are many, anyone ever been to any of the acupuncture clinics in the area? Raise your hand. There's also community acupuncture. There's an acupuncture school in Berkeley that has a community clinic. And so the opportunities for alternative medicine and using it are quite frequent, and actually a lot of people do use it and find that it's very helpful. There are, like in some of the hospitals, they have some clinics that are for drug abuse. They use acupuncture for treating drug abuse, and that's kind of a community type clinic as well. So